think, what Sir Michael Marmot was referring to was that quality of life affects your health, and you are our health inequalities are exacerbated by a diminishing quality of life. Arts and culture are critical, central to your quality of life across all life phases, as I've said, and that is manyfold. It's about, in fact, somebody from the delegation earlier said, everybody, no matter where they come from or what their background, picks up a pencil and scribbles at their earliest of ages, right? So, we are inherently creative individuals. Slowly but surely, those creative skills are diminished by the system in which we grow and live. But engaging with creativity can support your health and your well-being because it allows you to see and hear other people's stories and connect across your community, across your country, across the world with ideas and stories that might resonate with you. It allows you to take yourself out of a moment if you're in crisis, to concentrate, to focus on something that's other than the bills, the kids, the pain. It provides you with that important creative stimuli which gets you thinking about solutions and problem solving rather than being done to, or on the receiving end of a challenge. It puts you in front of your best foot forward, if you like. That's the way, isn't it? And so I think for a very long time, arts and culture has been considered to be a nice to have. It is an essential to have because of all of those things. And the exclusive box that arts and culture sits in around, black box theatres is wonderful if you can afford it and if you can find your way to it. But there is arts and culture in the community for all. So one of the areas that we work in is rural Norfolk, Suffolk and Cambridgeshire, and that we meet a lot of people who are either hampered because there is no transport into their urban centres, so they couldn't get to those arts black boxes even if they wanted to. If there is transport, very often those arts and cultural events in those urban centres are happening after dark, and if you're an older person on your own, you're less likely to get on the public transport or drive yourself to those events. If you're on a pension, if you're unemployed, if you're raising a small family and your bills are through the roof, you probably can't afford a ticket to those black box events anyway. And so our work is about breaking down those barriers and saying, well, we're interested in bringing artists to where the people are, not asking the people to come to where the artists are. We're interested in taking live performance and cinema and creative workshops into village halls, into pubs, into libraries, onto the playing field, into the street. We're interested in asking the people in those rural communities, what is it you're interested in seeing or watching or doing? What are the needs of your community in terms of, have you got, wide-ranging dementia diagnosis? Have you got an older population? Have you got children, young people who have got no youth club? How can we use our arts and creativity to respond to your community and social need? And that is the importance of arts and culture for health and well-being, because as soon as you start asking those questions, then you can, and that's very often what happens in our world, you tailor your work to the needs of that community, and you use arts and culture as a tool for education and for health and well-being, and those two things are about decreasing health inequalities overall. I'm here with Creative Arts East and Dance East, actually, to host a workshop which is about the remedial and preventative role of arts and culture for patient and population health and wellbeing. That is about demonstrating how arts and culture uses co-production and co-design with people and with the communities that we support to provide evidence-led and person-centred health and wellbeing outcomes. So we are providing some key facts about the work of arts and culture across the country for health and social care. And we are case studying a programme from Creative Arts East called Our Day Out. For the last almost 10 years, the programme has provided fortnightly afternoon workshops for older people in between 9 and 11 rural communities across Norfolk. And those people come usually with a dementia diagnosis or with a degenerative illness and their carer. But sometimes they're alone, very often they can be alone. And they come not to talk about their diagnosis, not to talk about their sort of clinical issues. They come to develop their creative skills. They come to have something to talk about with their loved one when they go home, and to find new purpose in their life in a place where maybe their life has been limited or restricted somewhat. So we commission professional artists to design a series of workshops over a course of 2 or 3 months, where they will come. They might be Bollywood dancers, they might be African drummers, they might be ballet dancers or photographers. They will come and engage those participants in their creative activity, their creative practice, and then over the course of the next 6 or 9 sessions, they will invite those participants to be the artist in the room. So rather than, again, being done to, those participants are empowered to use their own creativity and find their own creativity, actually, find their own point of view and voice, artistic voice, and to make something that they would never have thought possible. So we have had groups of older people choreograph dances to poetry at Cly Wildlife Centre and then perform that to each other. We have had poems to the Queen at Jubilee, created through spoken words and poetry sessions with writers. We've had dancing and music. We've had CDs being recorded, and these people are the artists in the room, but they've been inspired by somebody who's a professional artist. So that's great in and of itself, but we've also been working with academics to track the health impact of those workshops on their well-being. And there has been a 64% increase on average in well-being of the participants, and a statistically significant increase in well-being against the Canterbury Christchurch scale. And what that tells us is that whilst you can take a pill to alleviate sadness, depression, anxiety, that it lasts for a very short period of time, and it doesn't also provide you with the wraparound quality of life that you need to sustain the effects of that pill. Whereas coming to a 2-hour workshop, engaging with 10, 15 other people who you recognise because they're in the same stage of their life, being inspired by an artist, having a cup of tea and a slice of cake, talking about your day, talking about your worries, that sustains you for almost a fortnight, and your well-being increases as a result of that. and it sustains you for that fortnight because you've got something new to talk about to your loved one, you've got something new to think about in that period of time. You've shared something of yourself with a stranger that you would never have had the opportunity to do. And all of those things are really intangible and hard to evidence, but they are what the arts and cultural sector brings to health and well-being, which isn't provided by a sort of prescription for medicine or, by a sort of standing in the A&E line necessarily. So my role today as part of this conference is to really, champion and provide a voice for what is a critical area of health and social care, but that is, a whole other sector, and often unseen in that sort of preventative area of work. For so long, the arts and cultural sector have been talking to ourselves. We know that what we do is good and worthwhile, but because these things are so intangible, they don't have sort of robust evidence. And very often when we go to a public health commissioner or a local authority commissioner or a integrated care board commissioner, whatever they're called now, very often they say, well, prove it, evidence it. And 5 or 10 years ago we couldn't do that as a sector. Well, we have worked hard to evidence that, and now what we need to do is to really drill down into the cost saving benefits. How does a session of creative activity translate to a monetary saving for the National Health Service or the health and social care sector, by investing in a preventative role with arts and health? How can we save